The following segment is sponsored by Portland Ketamine Clinic.
Welcome back to AM Northwest. Do you or a loved one struggle with depression or another mental health disorder, but traditional medications haven't improved your quality of life? Here to share more about a therapy that could help, we welcome from the Portland Ketamine Clinic, Dr. Enrique Abreu. Good to have you with us.
Thanks for having me, Helen.
First of all, what is ketamine?
Ketamine is an IV medication that was developed in the late 60s and early 70s to treat or to basically give sedation to patients that are having surgery or anesthesia or need pain relief in the operating room mostly. And it's been used for 40 or 50 years safely in hospitals and clinics all over the world.
Was it used because of people who maybe are allergic to other anesthetics?
No, it was used because it's a medication that wears off very quickly, and they wanted an anesthetic that wasn't as long acting as something like sodium thiopental.
Oh,
so
okay.
It's very short acting. It goes away very fast.
Gotcha. Okay, so tell me about the Portland Ketamine Clinic.
So at Portland Ketamine Clinic, we treat now a multitude of mental health disorders with ketamine, mostly depression, bipolar, PTSD,
wow,
OCD, anxiety, and some rare pain syndromes as well.
How did you get started? Because you started, what, in 2013?
Yes, exactly. But I've been doing anesthesia for about 20 years in the operating room. And then in about 2010, I left the operating room and opened an IV dental sedation practice where we treat patients in dental offices for sedation. And somebody found my card, a patient found my card at a dental office, and he had depression, and he had read the research that was put out by the National Institutes of Mental Health in probably 2010. And he found my card and knew I was an anesthesiologist and called me and said, "Hey, I want ketamine for my depression."
Right.
But I didn't know what he was talking about because I didn't know about that research yet. And so he opened my eyes to that in late 2012. And when I read the research, I said, well, I could treat you. I have the skills to do that.
Right.
And so we treated him, and he did really well. So he was the first patient in 2013. And at that point, I did the research and saw there was other clinics doing it. So I opened the first ketamine clinic in Oregon in 2013.
Wow. Okay, explain from start to finish what happens when a patient comes into your office.
So the patients get a referral from a psychiatrist, and if they need a referral, we have a list of psychiatrists on our website that they can go to. My office would schedule them for a series of 6 infusions over a period of 2 weeks, so like every other day. And then they come in with a friend or family member, and that day they'll have an hour infusion. It's a 40-minute infusion and 20 minutes of recovery. And they're in a private room.
Are they conscious while they're getting it?
Oh yeah, they're fully conscious. It's sub-anesthetic, so people are feeling like a little altered or sedated or a little out there and weird, but they're not feeling asleep. They're never unconscious. And then they're in a private room where they're being monitored by myself and my medical assistant.
Right.
And then they're able to put in their own music on Bluetooth speakers for the hour-long infusion. And then they go home with a friend or family member. And then the antidepressant will last about a month.
How long before they feel that it's working?
So after the series of 6 infusions, it's maybe 2 or 3 days, and they're feeling better pretty quickly after that. And there's very little side effects. Some people can say there's a little bit of nausea with it, but I think most people, if they don't eat or drink beforehand and they come in with an empty stomach, that they do really well and they don't get nauseated. But we also have anti-nausea medication to give patients if they need that, or if they're anxious, we have some anti-anxiety stuff as well.
Wow, who's a good candidate for this kind of treatment?
So patients that have mental health things like depression, PTSD, bipolar, they can find out more information on our website at portlandketamineclinic.com, and/or they can also schedule a consult with myself on the phone, a free phone consult, or a free in-person consult if they want to come in and check out our facilities.
Yeah, that's what, and I understand that you are never late. I like the way you think about this.
That's right. If you show up for my clinic at 3 o'clock at 2:58, my assistant's going to bring you in my office, so you're not in my waiting room waiting for half an hour for me to show up, because everybody else's time is important just as mine is, so we're very conscious for patients' time.
Yeah. You touched on earlier how it's a little different than other medications for depression, but go into a little bit more detail about that.
Yeah, so lots of folks have been on SSRIs or serotonin-based drugs for depression. However, they don't get a lot of help with them, and some people have a lot of side effects with those, such as weight gain or emotional issues or sexual dysfunction. Ketamine doesn't have any of those, and it's also in a different family of drugs. So since Ketamine is a glutamate agent, and it works on the NMDA receptor and not the serotonin receptor. So even though 10 or 20 different antidepressants may have not worked for people, there's a really good chance of ketamine helping them because it works on a completely different pathway and it doesn't have those side effects.
That is fantastic. You have a lot of great success stories, I understand.
We do. We have a lot of patients that have not been helped by many other antidepressants, and finally, after decades, they find this, and we can help them, which is great. They can go off of their other antidepressants.
Love it. We want to tell everyone, if you'd like to find out more about the Portland Ketamine Clinic, the number is 503-207-4992. We'll put the information on our website at KATU.com/AMNW. Doctor, thank you so much.
Thanks for having me, Helen.
You bet.
Always